Now, almost a year ago to the day, the COVID-19 pandemic in South Africa, lockdown restrictions have been eased to alert level 1. Now, this means a change in curfew times and relaxed protocols on alcohol sales, among other things. Our reporter, Karinda Jagmohan, is in KwaZulu-Natal live to us this morning, and that's where the first COVID-19 case was first detected. Karinda, I'm sure you remember that day quite vividly, but how are people reacting this morning to eased lockdown restrictions, alert level 1, and what that means?
Good morning to you. Well, there have been mixed reactions to the new lockdown restrictions, alert level 1, but specifically from businesses. They've welcomed the ease of restrictions because for them this means a turnaround in their specific businesses. I'm standing in the heart of Florida Road in Durban, and this is where there's a chain of restaurants that usually operate very late into the evening. So for restaurants and businesses and bars as such that actually exist on this particular stretch of road in Durban, they've welcomed these restrictions because for them it means they have more chance of turning a better turnover rather in this time, especially because they've suffered a lot during the most parts or the main parts of lockdown, especially lockdown level 5, and when there were further restrictions in the sale of alcohol. But we've seen those restrictions being eased now, curfew as well, now from 12 to 4 a.m. So for them, they'll be allowed to have patrons much later in the evening as well as sell alcohol during those times. So many business owners as well as the people who work at these businesses have especially welcomed these restrictions. But like you said, KwaZulu-Natal has had a tough year. We saw the first case detected, the first COVID-19 case detected this time last year in Hilton. And at that point since then, our province has really been fluctuating in terms of the number of active cases we're seeing, especially at times reaching the 40,000 mark. But as of yesterday, the number of active cases in the province is at just over 9,700. The number of deaths, however, today is at over 9,600. It's 9,610, which really goes to show that while we're seeing a decline in the number of daily cases emerging, especially as we move away from the festive season into March, still the concern about the spread of COVID-19 exists as we're seeing the number of deaths still increase. People are still succumbing to COVID-19, and thus the message to, of course, protect oneself and others during this time. Vaccinations also on the way. It's still not clear in terms of the number of healthcare workers per province that have been vaccinated, but so far we understand that over 70,000 healthcare workers have been vaccinated, and soon we expect the rollout to begin to members of the public. Today, Michelle, I'll be speaking to the residents of Durban about how they feel about the new level 1 lockdown and how as well their lives have changed over the past year. I remember this time just before we broke the story about the first case of COVID-19 being detected, we went around the streets here, Florida Road, as well as the local universities, asking people if they knew about this virus that seemed to be taking over the world at that point. It hadn't reached South African shores yet. Many people didn't know what COVID-19 was. They didn't understand it. But today we know that it has affected and impacted the lives of everyone. So we're going to find out how their lives have changed. And a year later, as we increase into, or we see an ease of restrictions and we see this level 1 lockdown, what are their plans going forward? Do they still believe they're going to remain safe? And how do they feel about the vaccine rollout? So we'll be bringing you that story this evening.
Yeah, absolutely. And, you know, the other issue, of course, that we want to speak to as well is that we are not immune to a third wave of infections, particularly in KwaZulu-Natal, where during the peak of the second wave, your province was leading with the most daily new infections, the most active cases, and at one stage as well, the most deaths that were reported every single day from the health department. Sihle Zikalala, the KZN Premier, has been vocal throughout the past few months, the past few years. Going to be interesting to hear what he has to say about how the province will stave off a third wave of COVID-19 infections.
Yes, indeed. In fact, just last week, the Premier delivered the State of the Province address. And, you know, like with the State of the Nation address, much of this in the discussions around COVID-19 and the impact it has had on the province, not just on the economy, but health-wise. And since over the last year, we've been to various events where we saw businesses as well as governments coming together to try and, assist people on the ground who are suffering from COVID-19, as well as to create more field hospitals that will assist people who can't be in isolation at their own homes. Those field hospitals have since been closed, or they've been temporary facilities because they're not needed at this point. But definitely so, over the past year, KwaZulu-Natal has seen high numbers of COVID-19. In fact, around January, December, January, we're in the 40,000 mark and seeing a number of deaths. And just this weekend, we saw KwaZulu-Natal recording among the highest number of deaths in the provinces in the country. So it's still a cause for concern on the ground with regards to the spread of COVID-19, and especially to see now how the health department will go forward in terms of unrolling vaccines. You must know, Michelle, that KwaZulu-Natal is largely a rural province, and while we are going to see an increase in the number of vaccine sites, it's going to be interesting to see how the health department, how the local government will ensure that vaccines can be rolled out to the poorest of the poor in rural areas where they don't even have access to healthcare facilities to begin with. They have to travel long distances across, dirt roads sometimes to get to these facilities. So it's going to be interesting to see how we can bring these vaccines to people who need it the most at this time in what is mainly a rural province or largely a rural province, and how we can get help to people in those areas.
Yeah, absolutely. Lots of issues there that we iron out as we head into alert level 1. Karinda Jagmohan, thanks very much for that. She's live to us there from KwaZulu-Natal.